Now, how to diagnose diabetes? Well, it depends. If the patient has symptoms, if the patient is symptomatic already, polyuria, polydipsia, polyphagia, or peripheral neuritis, any symptoms that suggest diabetes, it's enough to have a random blood glucose more than 200. This, together with the symptoms, will be enough to diagnose diabetes. But if the patient does not have symptoms, like when you're during screening, you're screening patients for diabetes. You have like a 40-year-old hypertensive patient and he's overweight, and you regularly check his fasting blood glucose for the development of diabetes. Here you need 2 readings of fasting blood glucose 126 or more. 2 readings of fasting blood glucose 126 or more will diagnose diabetes in non-symptomatic patients. If I ask you what is the most accurate test to diagnose diabetes, your answer should be the glucose tolerance test, the 2-hour postprandial plasma glucose level. And do we do it frequently? Only to diagnose gestational diabetes, only when we are concerned with the development of diabetes during pregnancy. We do this test, oral glucose tolerance test. We get your fasting blood glucose and then we give you a very sugary syrup to drink it, and 2 hours later we measure your plasma glucose. If it is higher than 200 milligrams after a 75-gram glucose load, this is sufficient to diagnose diabetes. Again, as I said, now we only do it to diagnose gestational diabetes. How about hemoglobin A1C? Hemoglobin A1C can be used to diagnose diabetes, and you have to have hemoglobin A1C higher than 6.5%. Higher than 6.5%. Hemoglobin A1C is a very important test that needs to be done for all diabetic patients. Even when you diagnose diabetes by the random or when you diagnose diabetes by the fasting, you still have to do hemoglobin A1C, because this is going to put your diabetic patient in one of 3 categories. And based on these categories, you will fashion your treatment. So don't forget, hemoglobin A1C in diabetics is always higher than 6.5. Before I go into the management of diabetes itself, it's very important to manage the metabolic syndrome risk factors that are triggered and induced and augmented by diabetes. So there is a general management lines of managing a patient with diabetes. Always think of his blood pressure. Do hypertension screening. If the blood pressure was found twice higher than 140/90, you can start treating the blood pressure, and the best treatment for blood pressure in diabetics is usually ACE inhibitors. Also, screen for the kidney nephropathy. And what's the earliest sign that the kidney is affected by the diabetic condition? It is microalbuminuria, traces of albumin in urine. Also, you have to check your LDL. If the LDL in a diabetic patient is more than 70, this necessitates what? Statins. Obesity. You cannot control diabetes without controlling weight. So you have to refer your patient to a dietitian. You have to advise for lifestyle modification, even up to bariatric surgery. You have to do something for the patient's weight. Retinopathy screening. Refer the patient to an ophthalmologist to check about his retina, because proliferative retinopathy needs to be treated. Infection prophylaxis. Don't forget, these patients are very, very vulnerable to infections. So let your patient be on top of his vaccinations, especially for the flu and pneumococcal vaccines. Also, you need to reduce the cardiovascular risk. If the patient was smoking, always advise to stop smoking and put the patient on low-dose aspirin once daily if older than 40 years in order to avoid or to inhibit platelet aggregation and reduce the incidence of the first heart attack. In general, how are you going to manage diabetes? We have to use 3 strategies. Number 1, healthy eating, exercise, and medications. And it's always advisable to start first by trying healthy eating and exercise. You know what? up to 25% of diabetic patients can be controlled only by managing their diet and doing exercise. 20 minutes of exercise in the morning is gonna increase the sensitivity of your tissues to insulin the rest of the day. Can you believe that? Just 20 minutes of exercise in the morning and you are gonna be sensitive to insulin for 24 hours. Exercise does miracles for diabetics, but the most important thing is diet. Diet is the most important thing. So we say in diabetes, diet first, diet last, and diet always. You cannot control diabetes even if you give insulin, as long as you don't control your diet. Insulin, if you don't manage your diet, is going to make you more obese. Then we're going to categorize our diabetic patient based on his or her hemoglobin A1C level. If the hemoglobin A1C is more than 6.5%, that's diabetes. If it is not higher than 7.5%, this is the stage where you need only one monotherapy, one drug. And the first drug of choice is always going to be metformin. So if the patient's hemoglobin A1C is not higher than 7.5, this is one drug, give metformin. If the patient's hemoglobin A1C was anywhere between 7.5 and 9%, you need to add another drug to metformin, dual therapy. Patients with hemoglobin A1C more than 90%, usually these patients will need insulin therapy. Sometimes some endocrinologists will try to give triple therapy. But tell me, who is the diabetes patient that's going to be compliant on 3 medications only for diabetes? And don't forget, he might be taking medications for his dyslipidemia, medications for his blood pressure, aspirin for prophylaxis, and vitamin B for his neuropathy. So it's a lot of medications. So better to put the patient even for a brief period on insulin to lower this hemoglobin A1C, and then you can use dual therapy or even monotherapy. And the recommendations, what are your goals? What are your goals? Well, this depends on who are you listening to. If you were listening to the American Diabetes Association, you want your hemoglobin A1C less than 7, 6 point something. If you're listening for the American Association of Clinical Endocrinologists, they are kind of more tight in managing diabetes. You want your hemoglobin A1C less than 6.5. Less than 6.5. So as long as you are less than 7, you are okay. You also have guidelines and goals for your blood pressure. The blood pressure of a diabetic patient is better kept under 130/80. Why? This is going to be protective for their kidneys. And the LDL level, the low density lipoproteins, is better to be kept less than 100. Less than 100.